Today is Colorado Wear Teal Day. It's meant to raise awareness for ovarian cancer, which, by the way, September is Ovarian Cancer Awareness Month as well. According to the American Cancer Society, there are more than 19,000 new cases of ovarian cancer each year.
Yeah, so we're wearing teal this morning to help raise awareness. And joining us now to talk a little bit more about ovarian cancer is 9 News medical expert Dr. Pyle Coley. Dr. Coley, thank you for joining us with this.
Good morning, guys.
We appreciate this. It's an important conversation. What are some of the risk factors for developing ovarian cancer, and can we do anything to lower that risk?
You know, ovarian cancer is one of those sneaky cancers. You think about the ovaries, they're deep down in our pelvis, so it's really hard to detect. The symptoms can be really nonspecific. So I want every woman to think about her risk and her individualized risk factors. And so the things that kind of raise your risk most likely are advancing age, being postmenopausal. Having had breast cancer can mean you have a higher risk of ovarian cancer. And for some of us, we carry those BRCA or BRCA mutations. If you're Ashkenazi Jewish descent, that can also raise your risk. If you have a condition called endometriosis, that can raise your risk as well. And if you've never given birth, that can raise your risk. So the opposite is also true. If you've, given birth or been on birth control for 5 years or longer, the concept here is that being on birth control turns off ovulation. Ovulation is a popping open of the egg from the ovary, so it kind of rests the ovary. So it prevents damage to the surface of the ovary, and that's one way in which it can be associated with a lower risk. Breastfeeding, similar concept here. If you breastfed for a year or longer, then it kind of shuts down the ovulation.
So if someone's sitting at home, they're like, "Ooh, I fall in some of these categories." Who should be screened, and what does screening even look like?
So we're only screening high-risk people or symptomatic people, and that's really important. So it's not like breast cancer or cervical cancer where all of us get our screenings done on a regular basis. It's only the high-risk people, so these people with these genetic mutations of family histories or people who have symptoms. And it's a tough one to screen. So we sort of really rely on imaging tests here, where we do what's called a pelvic ultrasound. We put a probe in the vagina, we look from the outside and we look from the inside and try to characterize if there's any tumors or masses or lesions. But again, that cancer has to get big enough for it to show up on an imaging test. Now there's a blood test called CA-125 that you can check to see if it's associated with ovarian cancer, but that's elevated in 1% of healthy people. It can go up with menstruation. So it's very non-specific, and you can have a cancer and not have it elevated. So it's a tough one in terms of even diagnosis and screening.
Overall, that's a pretty narrow group of people. I want to piggyback off of what Corey was just asking you. Why not screen everybody?
Yeah, so we've thought about this, and we've actually looked at the data here. So ovarian cancer overall is pretty rare. And if we start screening every woman, when we're menstruating, our ovaries make cysts, they make masses, and the vast majority of ovarian masses and cysts are benign. So you're going to get a lot of false positives and a lot of false negatives if you just start doing ultrasounds in every woman, which would lead to a lot of procedures, operations. And the data really tells us that looking at blood tests and ultrasounds in every woman who's low risk does not reduce ovarian cancer mortality or diagnose the cancer any earlier.
Real quick, we want to talk about some of the symptoms because that's really important for women to know.
It is, and this is the key here. Because we're not screening everyone, every woman needs to be tuned into her risk and her symptoms. And there's really 4 symptoms that a study recently looked at, that if you're having any of these and you get fast-tracked to get screened, you can actually pick up earlier cancer. So one is bloating. Think about just your belly feeling more full. The second is feeling full quickly, so early satiety. Third, having to urinate more frequently, which can happen after menopause, but certainly you should talk to your doctor about it. And the fourth is abdominal pain or pelvic pain with intercourse or even otherwise. These are all signs that you may have to get screened. Now, they can be nonspecific signs like fatigue and weight loss and such as well, but anything pops up that seems unusual, know your body and please talk to your doctor.
Knowing those symptoms is key for everybody, including men, so maybe you can help out your spouse or your girlfriend or whoever, any woman in your life. Dr. Coley, we appreciate you being here with that conversation. By the way, you can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.